Hey folks, Dr. Ryan Brandon here. Let me tell you something. We need to have an honest conversation today, and it's not going to be comfortable for everyone. But as a physician who's spent decades in medicine, I've learned that the most important conversations are often the hardest ones to have. So, let's talk about President Trump's health. And before anyone clicks away thinking this is just another political hit piece, hear me out. This isn't about whether you voted red or blue. This is about something far more fundamental. The health and cognitive fitness of the man sitting in the Oval Office. Because here's the thing. When you're 79 years old, and you're running the most powerful nation on earth, your health isn't just your business anymore. It's all of our business. Now, I've been watching what's been happening, and I've got to be honest with you. The Democrats are absolutely making this a political weapon. Recent polling shows that 88% of Democrats and 68% of independents believe Trump's health and age affect his ability to fulfill presidential duties, compared to only 34% of Republicans. That's not just a partisan divide, folks. That's a canyon. But here's what I want you to understand as a medical professional. Regardless of the politics, the concerns about cognitive decline in our leaders are legitimate medical questions, and they deserve legitimate medical answers, not political spin from either side. Let me break down what we're really looking at here. In April 2025, 3 months after Trump's second inauguration, the White House released results from his physical examination and cognitive assessment, concluding he was in excellent health and fully fit to serve. Perfect, right? Case closed? Well, not exactly. You see, as a doctor, I have to tell you, official statements are one thing, but observable behavior is another, and that's where things get interesting. Throughout 2024 and into 2025, we've seen some concerning patterns. We're talking about confusion between people like Nikki Haley and Nancy Pelosi, claiming to be running against Barack Obama when his opponent was Joe Biden, and speech patterns shifting toward shorter sentences, more tangents and increased repetition. Now, before you start yelling at your screen, let me be clear. I'm not diagnosing anyone from my chair here. That would violate every ethical standard in medicine. It's called the Goldwater Rule, and it exists for good reason. But what I can do is explain what these patterns might indicate from a medical standpoint, and why people are right to ask questions. Think about it this way. If your 79-year-old father started showing these same patterns, mixing up names, tangential speech, repetition, wouldn't you be concerned? Wouldn't you want him checked out? Would you feel comfortable with him making life and death decisions for hundreds of millions of people? The frustrating part for me, as someone who's dedicated my life to medicine, is watching this become a pure political football. Democrats are weaponizing legitimate health concerns, while Republicans are dismissing them entirely. And somewhere in the middle, we've got a 79-year-old man whose actual health status remains frustratingly opaque. Trump recently claimed he aced 3 cognitive exams, stating that few people can perform well on them, and that most presidents have decided not to take them at all. But here's what you need to know about that test. It's called the Montreal Cognitive Assessment, or MoCA. And folks, it's not the rigorous examination Trump makes it sound like. The MoCA is a screening tool. That's it. It's designed to catch obvious cognitive impairment, things like severe dementia, or significant memory loss. It asks you to identify animals, draw a clock, repeat words. A toddler can answer many of these questions. A score of 26 out of 30 is considered normal. It's not an intelligence test. It's not measuring your brilliant strategic mind. It's checking if your brain is basically functioning. So when Trump brags about his perfect score of 30 out of 30, what does that actually tell us? It tells us he doesn't have severe dementia. That's about it. It doesn't tell us about subtle cognitive changes, executive function issues, personality changes, or the dozens of other things that can happen as our brains age. And that brings me to the real issue here: transparency, or rather the lack of it. See, medical transparency used to be standard for presidential candidates. You release your records. Voters see what they're getting. Democracy functions. But in recent years, that norm has broken down. Trump declined to release health information, going back to 2015, when he first started running for president, despite promising in August 2024 to release records from a recent examination. Why does that matter? Because when you're asking the American people to trust you with nuclear codes, with economic policy that affects millions of lives, with healthcare decisions during a pandemic, You owe them transparency about whether you're physically and mentally capable of doing the job. Look, I get it. Aging is hard. Nobody wants to admit they're slowing down. And there's a lot of dignity at stake here, but the presidency isn't about one person's dignity. It's about the safety and well-being of 330 million Americans. So here's where we are. Democrats see a political opportunity, and they're taking it. They're pushing hard on Trump's age and cognitive fitness because, let's be honest, it's effective messaging. Before the 2024 election, 56% of Americans thought Trump's health would affect his ability to perform duties. After his inauguration, that number jumped to 63%. The concerns are growing, and Democrats are amplifying them at every opportunity. But Republicans aren't blameless here either. They're dismissing legitimate medical questions as political attacks, circling the wagons, and refusing to acknowledge that maybe, just maybe, we should all be concerned about the cognitive fitness of a 79-year-old president, regardless of party affiliation. What frustrates me most as a physician is that we could have a straightforward, nonpartisan answer to these questions. Independent medical examination, comprehensive cognitive assessment by board-certified neuropsychologists, full transparency. Release the results. Let the chips fall where they may. But that's not happening. And in the absence of transparency, speculation fills the void, partisan warfare takes over. And the American people are left wondering, is our president healthy enough to do the job, or are we being lied to? Next chapter, we're going to dive deep into what cognitive decline actually looks like, how it's measured, and why the tests Trump has taken tell us a lot less than you might think. Stay with me, folks. This is about to get really interesting. Alright, let's get into the medical nitty-gritty here, because if we're going to talk about whether Trump's health is being weaponized politically, we need to understand what we're actually looking for when we assess cognitive function in older adults. And trust me, it's a lot more complex than remembering person, woman, man, camera, TV. First things first. Aging affects everyone's brain. That's not political. That's biology. After age 65, the risk of cognitive decline increases significantly. We're talking about a spectrum here, from normal age-related changes all the way to severe dementia. And here's the kicker. Most of that decline is subtle and happens gradually over years. When I evaluate older patients in my practice, I'm looking for specific things. Changes in executive function. That's your ability to plan, organize, and make complex decisions. Problems with word finding. Increased impulsivity or decreased inhibition. Personality changes. Difficulty with abstract thinking. These are often the first signs that something's changing upstairs. Now let's talk about what we've been observing with Trump. And I want to be crystal clear here. I'm discussing publicly observable behaviors that have been documented and reported, not making a diagnosis. Mental health professionals and neurologists have pointed to observable behaviors, including tangential speech, confabulation, repetition, word-finding difficulties, impulsivity, and gait instability. From a neurological standpoint, these patterns are significant. Tangential speech, where you start talking about one thing and drift to another topic without completing your thought, that's a red flag. Confabulation, where you fill in memory gaps with fabricated details, that's another concern. And repetition, well, that can indicate problems with short-term memory encoding. But here's where it gets politically messy. By 2024, Trump's speeches showed shifts toward shorter sentences, more tangents, more repetition, more all-or-nothing thinking, and more confusion of words and phrases. Patterns that could indicate cognitive decline, could indicate. That's the operative phrase, because from a medical standpoint, we can't diagnose cognitive decline based on speech patterns alone. We need comprehensive testing, and that brings us back to the MoCA test that Trump keeps bragging about. Let me explain why that test, while useful as a screening tool, tells us remarkably little about the kind of cognitive function you need to be president. The Montreal Cognitive Assessment takes about 10 minutes to complete and asks patients to follow simple instructions. Identify animals, draw shapes, and repeat words. It's designed to catch obvious impairment, but the presidency requires high-level executive function, strategic thinking, complex problem-solving under pressure, the ability to synthesize massive amounts of information and make life-or-death decisions. The MoCA doesn't test any of that. Think of it this way. If you wanted to know if a pilot was fit to fly a 747, would you just check if they could identify pictures of animals and remember 5 words? Of course not. You'd do a comprehensive assessment of their judgment, reaction time, decision-making under stress, and cognitive flexibility. The same standard should apply to the presidency, arguably an even more consequential role. Now, Trump's defenders will point out that he's undergone multiple MOCA tests and scored perfectly each time. Trump has taken the Montreal Cognitive Assessment on 3 separate occasions and claims to have aced all of them, receiving perfect scores of 30 out of 30. And look, that's good news. It means he doesn't have severe dementia. But it doesn't tell us about subtle changes in executive function, personality, or judgment that might be occurring. What's particularly interesting from a medical perspective is Trump's own understanding, or misunderstanding, of these tests. Trump has described the cognitive test as really hard aptitude tests, and suggested that younger Democratic lawmakers couldn't answer the later questions. But folks, these aren't aptitude tests or IQ tests. They're dementia screening tools. The fact that he characterizes them this way raises its own questions about insight and understanding. There's also something called test sophistication that we worry about in medicine. When someone takes the same test multiple times, they can improve their scores simply through practice and familiarity, not because their cognitive function has actually improved. So those perfect scores on repeated MOCA tests, they might not mean as much as Trump suggests. What would I want to see if I were evaluating Trump's cognitive fitness? A comprehensive neuropsychological battery. We're talking hours of testing, administered by board-certified neuropsychologists, assessing multiple domains of cognition, executive function tests, memory assessments at various time intervals, tests of processing speed, evaluation of cognitive flexibility and problem solving, and importantly, testing that's sensitive enough to detect subtle changes over time. I'd also want a comprehensive neurological examination, including advanced imaging, not just an MRI to rule out strokes or tumors, but functional imaging that can show us how different parts of the brain are working. Trump confirmed he received an MRI at Walter Reed in October as part of what the White House described as a routine physical, though he told reporters he had no idea what they analyzed. That's concerning. As a physician, I'd want my patient to understand why they're getting tested and what we're looking for. There's also the issue of physical signs that have raised questions. Between December 2024 and March 2025, bruises were spotted on multiple occasions on Trump's hands, generating speculation about his health. Now, bruising in older adults can have many causes, could be medication-related, aspirin causes easy bruising, could be minor trauma, could indicate vascular issues. But the point is, these physical signs, combined with other observations, create a pattern that deserves thorough medical investigation. And let's talk about family history, because it matters. Trump's father, Fred Trump, had Alzheimer's disease. That's a significant risk factor. Doesn't mean Trump will develop Alzheimer's, but it does mean we should be particularly vigilant about early signs of cognitive decline. Here's what frustrates me as a physician. We have the tools to answer these questions definitively. Comprehensive neuropsychological testing isn't invasive or painful, it's just time-consuming and thorough. We could have clear, objective data about Trump's cognitive function. Instead, we're left with political theater, Democrats demanding transparency, Republicans dismissing concerns, and Trump bragging about a basic screening test, as if it's some kind of genius-level accomplishment. The politicization of this issue is preventing us from getting the answers Americans deserve. Because here's the thing, cognitive decline isn't shameful, it's a medical condition that affects millions of people. What is problematic is when someone in a position of enormous power and responsibility isn't forthcoming about their health status. Look, I've treated thousands of patients over my career, including many with cognitive decline. There's dignity in acknowledging when you're struggling and getting appropriate help. There's no dignity in pretending everything is fine when it might not be, especially when millions of people are depending on your judgment and decision-making. In the next chapter, we're going to look at the specific incidents that have raised concerns, the gaffes, the confusions, the physical signs, and examine them through a medical lens. What do they mean? What don't they mean? And how should we interpret them in the context of a 79-year-old president? Okay, folks, now we're getting into the specifics. Because if we're going to have an honest conversation about Trump's health being used as a political weapon, we need to look at the actual evidence that's fueling these concerns. And I mean really look at it. Not through partisan lenses, but through a medical lens. Let's start with the cognitive gaffes that have been documented. During the 2024 primary campaign, Trump made several notable errors, including confusing Nikki Haley for Nancy Pelosi claiming he was running against Barack Obama when his opponent was Joe Biden, and expressing fear that the nation might enter World War II. Now anyone can have a slip of the tongue, right? We've all been there. But from a neurological perspective, the pattern and frequency matter. When we see someone consistently confusing people who are contextually similar, like mixing up Haley and Pelosi, both women in politics, that's different from a random slip. That's a pattern that suggests potential issues with semantic memory and categorical thinking. And claiming to be running against Obama in 2024, that's not just getting a name wrong. That's temporal confusion, mixing up current events with past events. Now, Trump's defenders say he's just speaking off the cuff, that he's always been this way. And there's some truth to that. Trump has never been known for precise, carefully structured speech. But here's what we need to understand medically: baseline personality and cognitive style matters when assessing decline. The question isn't, is Trump different from other politicians? The question is Trump different from how Trump used to be? And that's where the linguistic analysis gets interesting. Multiple studies have compared Trump's speech patterns from the 1980s and 1990s to his recent speeches. The differences are striking. Shorter sentences, more repetition, more tangents, less complex vocabulary, more all-or-nothing thinking. These are the kinds of changes we see in people experiencing cognitive shifts. But let me be clear, linguistic analysis alone can't diagnose anything. What it can do is raise red flags that warrant further investigation, and that's exactly what we're not getting. Thorough, transparent investigation. Let's talk about the physical signs, because they matter too. Photographs and public appearances have shown bruises on Trump's hands and apparent leg swelling, becoming focal points between December 2024 and March 2025. Now, as I mentioned before, bruising can have many causes, but in a 79-year-old man, recurrent bruising and swelling raise questions about cardiovascular health, medication effects, and potentially underlying vascular disease. Trump was diagnosed with chronic venous insufficiency, a condition common in older adults, where blood in the legs has trouble flowing back to the heart. That's significant. Chronic venous insufficiency can be managed, but it indicates vascular issues. And here's what you need to understand. Vascular problems don't stay confined to your legs. If you've got poor circulation in your legs, you might have circulation issues elsewhere, including your brain. Vascular dementia is one of the most common types of cognitive decline after Alzheimer's. It happens when reduced blood flow damages brain tissue. Early signs, often subtle, changes in judgment, difficulty with planning and organization, problems with attention and concentration. Sound familiar? Now, I'm not saying Trump has vascular dementia. I can't say that without examining him and seeing comprehensive test results. But I am saying these physical signs, combined with the cognitive patterns we've observed, create a clinical picture that absolutely warrants thorough investigation. There's also been concerning video footage that circulated. On October 28, a video showed Trump wandering off while walking alongside Japan's Prime Minister Sanae Takaichi at Akasaka Palace in Tokyo. Look, everyone can have a momentary lapse in attention, but episodes of disorientation or getting lost during routine activities are classic signs of cognitive impairment. And then there's the issue of his awareness, or lack thereof, about his own testing. Remember when I mentioned he got that MRI? When asked about it, Trump told reporters he had no idea what they analyzed, despite having just undergone the test. As a physician, that troubles me. A patient should understand what tests they're getting, and why. The fact that Trump underwent a significant medical test and couldn't explain its purpose raises questions about his involvement in his own healthcare decisions. Let's also address the elephant in the room. Trump's response to health concerns. Trump called reports about his health seditious, perhaps even treasonous, claiming he works harder than ever and knows he's not slowing up. From a psychological and medical standpoint, this kind of response is concerning. Lack of insight into one's own declining abilities, we call it anosognosia, is actually a symptom of cognitive impairment. People with early dementia often don't recognize their own decline. They think they're fine, while everyone around them can see the changes. Now, does that mean Trump has dementia? No. But it means his vehement denial and inability to acknowledge any concerns should itself be seen as potentially significant data. Here's what's really frustrating from a medical ethics standpoint. We're watching all this play out in public with incomplete information. While partisan politics drives the narrative on both sides, Democrats are pointing to every slip and stumble as proof of dementia. Republicans are dismissing every concern as political persecution. And somewhere in the middle is the medical reality that we can't access because Trump won't allow comprehensive, transparent evaluation. Nearly 2/3 of Americans now say Trump's health and age affect his ability to perform his job, up from 56% before the election. That's a lot of concerned citizens, folks. And these aren't just Democrats. Independents are concerned too. When you've got 2/3 of the country worried about whether their president is cognitively fit, that's a problem that transcends politics. Some psychiatrists and psychologists have spoken out publicly. John Gartner, a psychologist and former Johns Hopkins professor, stated Trump was displaying clinical signs of dementia and demonstrating immense cognitive decline. But here's the ethical dilemma. These professionals are violating the Goldwater rule by diagnosing without examination. They believe the public safety risk justifies breaking that norm. Others argue it undermines professional ethics and feeds political warfare. I find myself torn on this. As a physician, I believe in professional ethics and the importance of the doctor-patient relationship. But I also believe in transparency and accountability, especially for public officials making decisions that affect hundreds of millions of lives. What would resolve this? Independent medical evaluation by a panel of experts, not chosen by either Trump or his political opponents. Comprehensive testing, full transparency with results released to the public. Let the chips fall where they may. But that's not happening. Instead, we get limited information, political spin, and a growing divide between what Americans can observe with their own eyes and what official statements claim. Governor Tim Walz questioned Trump's mental capacity, pointing to late-night ranting on Thanksgiving and concerning behavioral patterns, noting that presidents throughout time have released tax returns and medical records. Trump has done neither. He's right that transparency used to be standard. The question is, why has it broken down? In our final chapter, we're going to talk about what this all means for American democracy, what should happen next, and how voters should think about age and cognitive fitness when choosing their leaders. Because this isn't just about Trump, it's about how we handle these sensitive issues with all our aging leaders, present and future. The challenge is that this has become so politicized that it's nearly impossible to have rational policy discussions about it. Democrats push for transparency when Republicans are in office, and then circle the wagons when it's their guy. Republicans do the exact same thing in reverse. And meanwhile, Americans are left wondering, can we trust that our leaders are mentally fit to do their jobs? Concerns about Trump's health and age have grown since the start of his second term, with a percentage believing his health affects his ability to perform duties increasing from 56% before the election to 63% after. That upward trajectory matters. These concerns aren't going away. They're intensifying as people observe Trump's behavior and public appearances. What happens if Trump's cognitive function continues to decline during his term? That's the scenario nobody wants to talk about, but everyone's thinking about. The 25th Amendment provides a mechanism for removing a president who's unable to fulfill their duties, but it requires the vice president and a majority of the cabinet to invoke it. That's an incredibly high bar, and it's never been successfully used to remove a sitting president. So we could end up in a situation where everyone can see the emperor has no clothes, but the political mechanisms for addressing it are too cumbersome or politically fraught to use. That should terrify us, regardless of party affiliation. Let me bring this back to my medical perspective. In my practice, when I have concerns about a patient's cognitive function, I don't ignore it because it might hurt their feelings or because their family doesn't want to believe it. I address it directly, compassionately, but honestly. I get them proper evaluation. I make sure they and their families have the information they need to make good decisions. We should demand no less when it comes to our political leaders. Not because we want to humiliate anyone or score political points, but because we all, Democrats, Republicans, Independents, deserve to know that the person with their finger on the button is mentally capable of doing the job. Here's my challenge to both parties. Stop weaponizing health concerns and start taking them seriously. Democrats, if you're genuinely concerned about Trump's cognitive fitness, then support comprehensive, independent evaluation for all leaders, including your own. Don't just use it as a talking point when it's politically convenient. Republicans, if you truly believe Trump is cognitively sound, then support full medical transparency. Let independent experts conduct thorough assessments. Release the results. If Trump's as sharp as you claim, the testing will prove it, and you can throw it in Democrats' faces for the next 4 years. But what we can't keep doing is this: pretending that partisan loyalty is more important than the cognitive fitness of our president. That's not democracy. That's tribalism. And it's going to bite us all in the ass eventually. The American people deserve transparency. They deserve comprehensive medical disclosure from their leaders. And they deserve to be able to make informed decisions at the ballot box based on complete information about candidates' health and fitness for office. Will we get that? I'm not optimistic, to be honest. The political incentives all point in the wrong direction. But hope springs eternal. Maybe, just maybe, we can move past the partisan warfare and actually address these concerns like the mature democracy we're supposed to be. Look, I'm not naive. I know Democrats are using Trump's health as a political weapon. I know Republicans would be doing the same thing if the situation were reversed. They did it with Biden, after all. But acknowledging the political game doesn't mean we ignore the underlying medical concerns. Both things matter. Both things are true. As a physician, my job is to tell people the truth, even when it's uncomfortable. So here's the truth based on publicly observable behavior, documented speech pattern changes, physical health signs, and lack of comprehensive, transparent evaluation. There are legitimate reasons to be concerned about Trump's cognitive fitness at 79 years old. That's not a political statement. That's a medical observation. Should those concerns disqualify him from office? That's not a medical question. That's a political and personal judgment that voters have to make. But they should make it with complete information, not partial disclosures and political spin. And that's where we are, folks. Legitimate medical concerns being weaponized for political gain, while the truth remains frustratingly elusive. It's not good enough. We deserve better. And until we demand better from both parties, this cycle will continue with every aging leader we elect.